We will now move on to Maryland Senate District 12. This is a single seat. You can vote for one candidate. There are two candidates for the Democratic primary. Each will begin with 30 seconds of opening remarks, beginning with Clarence Lamb.
So good morning. I am Clarence Lamb. I'm one of the state delegates representing District 12 in the Maryland General Assembly, along with my colleagues, Delegates Hill and Ebersol. I am also one of 4 physicians in the Maryland General Assembly, and I practice at Hopkins, where I'm on faculty and see patients weekly. I'm running as a progressive leader with a proven track record as someone who will fight for social justice, who will reduce income inequalities, who will stand up to special interests, and who listens to our communities. We have a proven track record of supporting healthcare, safeguarding the environment, protecting the Chesapeake Bay, improving mass transit, improving our public infrastructure, as well as supporting education. Thank you.
Thank you. And now an opening remark from Mary Kay Siggety.
Good morning. As an experienced legislator, I know that government is about small, everyday things that make up our quality of life. How long is the wait at the MVA? Is my bus on time? Can I count on our election system to be secure? Is the food we buy safe? I also know it's about the big things. It's about educating our children. It's about whether or not drug treatment is available before it's too late. Will the drugs people need be affordable? Are we supporting economic growth and good jobs? I'm Mary Kay Siggety. I am an experienced legislator, and I look forward to this morning's questions.
Thank you. Let's begin our question session. If you would like to respond, please hold up your card so that I can call on you in the order in which you are seen. You will have 1 minute for each response. A timekeeper is sitting in the front row to let you know when you have 30 seconds remaining and when your time is up. Question 1. Do we need high-speed transportation between Baltimore and Washington? And if so, what would that look like and how would you fund it? Mr. Lamb?
Sure. So thank you for that question. I think we do need high-speed transportation between Baltimore and DC, including this area as well. I think we are seeing commute times increasing, and I'm concerned that we cannot build our way through highways and bridges out of the congestion that we're seeing. That supply, or demand rather, for transportation will only meet the supply in public infrastructure, so we do need to look at mass transit. We've seen that there are jobs available in the Baltimore area, and there are people who can't reach those jobs, whether it's in Linthicum or in Columbia or in Towson. And we need to have mass transit that helps make it easier for people to get to the jobs that are available out there. We have folks in Baltimore City, where the Baltimore Metropolitan Council has looked at where some of these jobs are, and the folks in Winchester and Sandtown can't get to Linthicum. They can't come down to Anne Arundel County or Howard County to be able to take the available jobs that are here. And so we need to depend on mass transit so that people can spend less time commuting, more time with families. It helps small businesses, it helps businesses in general to be able to get a good workforce to those jobs that are available.
Thank you. Ms. Siggety?
So you asked about high speed. We've certainly heard a lot about maglev getting us between Baltimore and Washington. That's a conversation we've had in the past, and one that I believe we should have again. But it's not just getting between Baltimore and Washington, it's getting between Washington and Columbia, it's getting between Columbia and Baltimore. We have the CSX lines. We need to improve service on the CSX. Increasing the number of trains will make it faster and easier for people to get to both locations. I'm a firm believer in the use of bus rapid transit. We have Route 29, we have Interstate 95, we have 695, we have 195. Those are all Route 40. We have all sorts of major roadways that we can turn into mass transit. It's going to take political will, it's going to take imagination, and yes, it's going to take funding. I look at the opportunity to perhaps raise the gas tax by another penny. That may, in fact, help us as we go into the future.
Thank you. Like the rest of the country and across income and class lines, Howard County is experiencing an opioid crisis, including the abuse of prescription drugs. What do we need to do to effectively respond to this crisis?
So, indeed, we are experiencing an opioid crisis. But according to the data in Howard County, alcoholism is still our biggest substance abuse. So it's not only opioids, it's also alcohol, it's also other things. We do, in fact, need to make treatment much more available. We need to have more beds available for in-placement treatment. We also need to have triage centers where people can go when they need it and know that once they get there, they will find services. We also have to recognize that addiction is not an illegal act, it is an illness, and we need to treat it as an illness, not as a crime. But we also have to attack some of the root causes. People are in pain. They're in pain because they don't have jobs. In fact, improving our job future and making sure that people are employed is extremely important. People are in pain because they don't have housing. Making sure that we have affordable housing is going to be important for their well-being. And making sure that we are funding mental health services is also important.
Mr. Lamb?
So thank you for that question. I think this is an incredibly important issue for our communities because we are seeing more individuals die from opioid overdoses every single day here in Maryland than we're seeing die from motor vehicle accidents. And when you think about that, we as a state really need to step up and do more. We're seeing an epidemic of ginormous proportions, and we need to address that through a variety of different means. We, over the last couple of years, have taken some first steps that we will continue to advance over the next couple of years. For example, we introduced a prescription drug monitoring program to reduce the ability of patients to be able to doctor shop. We also increased funding for treatment in beds because we know that when people are suffering and they want to seek help, that window for them to be able to be willing to seek that help is very narrow. And if they're not able to access a bed or access a counselor in that time, that window might pass. We've also increased the ability of folks to have the overdose drug naloxone, Narcan, which is incredibly important in allowing folks to be able to continue to seek treatment. We've also increased funding for behavioral health and mental health and substance abuse programs. We found that incredibly challenging, that those are oftentimes the first things being cut, and we've restored that funding as well.
Last question. Maryland recently passed legislation requiring domestic abusers to turn in their firearms. How would you enforce this?
So, gun violence prevention is an incredibly important issue. As a public health physician, we recognize the increasing challenges to our communities who are being strained by gun violence, and we need to do more as a state. Over the past couple years, we've taken a few good first steps. We've banned bump stocks here in Maryland. We've also enabled law enforcement to identify folks that have been red flagged by doctors, neighbors, and others in the community to remove guns from those homes. And also to your question about domestic violence and removing guns from homes where domestic violence has been occurring, it's incredibly important because we know that the risk for individuals in homes where there have been domestic violence is incredibly high if there's a firearm. We need to support law enforcement through additional funding and protections to be able to go in and retrieve that, and we look forward to continuing to do that. I'm also supported as one of the gun sense candidates for the Moms Demand Action because of the positions that I've taken in support of gun violence prevention legislation. We must do more, we can do more, and we will.
Ms. Sigerty?
So, Dr. Lamb, you have had the opportunity to act on gun violence. Unfortunately, as a county council member, I've had limited opportunity. But I recognize that in getting the guns, we need to, in fact, we need to fund our sheriffs and our police officers so that they have the resources necessary to go and to carry out the directives of the law as well as of the courts. We also have to make sure that they have good training, because the training that they will need in order to accomplish this is complex. They're dealing with folks who oftentimes have behavioral health issues and are perhaps not wanting to give up those guns. In addition, though, we're probably dealing with illegal guns, ones that are not registered, ones that we don't know about. And so with the assistance of the court, we need to get our law enforcement into people's homes and into, in relation to domestic violence issues.
Thank you. Each candidate will now have 30 seconds for closing statements, beginning with Mary Kay Sigerty.
As a legislator, I've approved budgets that have supported education, built and renovated schools, libraries, fire stations, and senior centers, created health care for our county's uninsured, and put over 100 new police officers on the street. I've also established a senior tax credit. I've also created affordable housing opportunities. Make no mistake, this election is about leadership, it's about listening, it's about decision-making, and it's about integrity. I am extremely honored to have Senator Casemeyer's endorsement in this election. I've served you for the last 14 years, and I ask for your vote on June 26th.
Thank you. Mr. Lamb?
Thank you to the League of Women Voters for hosting this important event, and I'm Clarence Lamb, running for the state Senate because I believe we need to have a progressive leader with a proven track record, and that's why I've been endorsed by many groups, including our Howard and Baltimore County teachers, environmental groups like the Sierra Club, League of Conservation Voters, Food and Water Action, labor groups like SEIU and the AFL-CIO, our local Democratic Club, CDC, Thurgood Marshall Democratic Club, Baltimore County Progressives Club. I'm running with delegates Hill and Ebersol because we have a proven track record that we hope to be able to continue in the legislature. And I encourage folks to learn more about my campaign on my website, clarencelam.com.
Thank you. Thank you both.